Hi guys, now we'll be discussing on one more important topic, that is electrical injuries. So let's start with the electrical injuries. See, electrical injuries, basically when we learn electrical injuries, it's due to the passage of the current. See, when we say current, first of all, you need to know there are two types of current. One is alternating current, another one is direct current. Okay, so alternating current, direct current, which is more dangerous, right? Which is dangerous? Both are dangerous, but which is more dangerous, right? AC is more dangerous than DC. They say 4 to 5 times more dangerous than DC. DC is also dangerous, but that comes in a higher voltage, it becomes more dangerous. Just like you get it in lightning, right? All these are DC. AC is what we get in domestic supply, right? So that is more dangerous than DC. AC is more dangerous than DC. As I told, this is 4 to 5 times more dangerous than DC. Now, when we discuss this electrical injuries caused by electricity, first of all, we need to know certain terminologies. We'll learn about few important terminologies. Number one, we have what is called as amperes, amperage, right? That is basically actually current flow, right? We have what is called as voltage, and we also have what is called as resistance. Right, so we have amperage, we have voltage, and we also have resistance. We have three important terminologies, right? So when we talk about electricity, like these three things are very important. But which is most important for causing death in electrocution? Which is most important, right? Most of you might be thinking it is voltage, but no, it is not voltage. It is the amperage that is most important for causing fatality in electrocution. Right? Most important factor that determines fatality in electrocution is amperage. So that is very, very important. That is the one that determines fatality, amperage. We'll discuss about that, right? And amperage, as you increase amperage, right, the injuries will be more, electrocution chances will be more. It is directly proportional. Voltage is also directly proportional, right? The flow will be more. As you increase the voltage, the current flow will be more. But resistance, it is inversely proportional. Whenever the resistance is more, the current passage will be less, right? When the resistance is less, current passage will be more. It is inversely proportional, right? When you see here, now I've told you amperage, I've told you voltage, I've told you resistance. And I've also told you that resistance is inversely proportional. When you increase the resistance, passage of electricity will be less. When you decrease the resistance, passage of electricity will be more. Just like you compare dry skin and moist skin, right? Now, again, if you see individually, the maximum resistance is offered by dry skin. Maximum resistance offered by dry skin, and followed by bone, followed by moist skin. Followed by moist skin, right? Moist skin offers very less resistance, very, very less resistance. Okay. Now, I told you this voltage directly proportional, right? What is the average fatal range of the voltage? That is 240 watts, right? 220, 240 is a normal range that we get in a domestic supply, right? Fine. So still, unfortunately, that is a fatal range. Okay, and I told you in the beginning that the amperage becomes the most important factor for causing fatality. I'll tell you now why. You see, as you keep on increase the amperes, if the ampere is very less, you touch, it's having only 5 milliamperes. If any wire is having electricity, you touch it, it's having only 5 milliamperes, you will have tingling and numbness, nothing more than that. You touch it, you release it. Okay, when it is little more, 10 milliamperes, even then the point is you will feel electricity, but still you will let the wire go, right? You will be able to release the wire. That what it means. Let go means you're able to release the wire. But the point is, when you increase it to 20 milliamperes, when it 20 milliamperes, the person may be able to touch the wire, but the person may not be able to release the wire. What is the reason? See, when the person touches this 20 milliamperes, there can be spasm, tetanoid spasm of the muscles of the hand. The person, because of the spasm, tightly catches the wire, right? Tightly, he will not be able to release it. That's called hold on spasm. Hold on spasm. The person is not able to release the wire. The more he catches the wire, the more current will pass, and the chances of fatality is more. Okay, so that is the reason why I told you amperage is the most important factor for causing death in electrocution. Okay, now as you keep on increasing the ampere, maybe 20, 30, 40, 50, right, more than that, the chance of arrhythmia is more and the fatality is more. Okay, it will cause cardiac arrhythmia and the person dies. Okay, so going forward, let us talk about what is the most important barrier for the electrical entry into the body. What is the most important barrier? The first and foremost important barrier is skin. Right, that is the most important barrier that we have got. Once the skin is breached, then it becomes very easy, right, for the electricity. Then on the converse, which is the least resistance, right, which part of the body gives the least resistance for electrical entry, you can say it is the blood and the body fluids. For the passage of electricity, the least resistance is offered by blood and the body fluids. Blood and the body fluids. Body fluids. Right? Fine. So these are the basic points that we need to know before proceeding into the route or the passage of current in the body and the injuries that it causes. Right? Let's go forward. Fine. Let us assume, okay, so let us say this is the ground and this is the person standing over here. Right? And this is the place where there is a wire and the person touches the wire. Okay, if the current passes, the person is touching the wire with your right hand, it is passing there and it is exiting out in the left foot. Right, the place where the current entry, that is entry mark, right? So this is where we get entry mark. This is where we get entry mark. And this is where we get exit mark, exit burns or exit mark, whatever. Right, exit mark will be in the form of split, skin split, or sometime burns, right? But we must always be carefully looking for the exit burns, right? And what about entry mark? Usually you will have entry mark, but sometimes you won't be able to see any entry mark at all, provided there are two important reasons, right? What are the two important reasons? Number one, if the point of contact, is so broad, right? If the point of contact is so broad, if there is broad surface area touching the skin, right, you will not have any kind of entry mark. Number one. Number two, if it is very low resistance, even then we will not be able to find out any entry mark. Particularly what happens whenever there is electrocution in a kind of bathroom setup where it is so dangerous, the entire setup will be completely wet, there is no resistance at all, the electricity can easily pass, the person can easily get electrocuted without entry mark, right? Particularly suppose when a person is taking bath in a bathtub, right, and it's completely filled with water, there is a chance of, if there is a chance of electrocution, the person can get easily electrocuted, no entry mark, right, because the surface area which is in contact with the water is so broad, right, there is no resistance at all, then the person can get easily electrocuted, it will be fatal, no electric mark at all. So do remember, there are two situations where there won't be any entry mark. Number one, if the surface area is very broad. Number two, if there is no resistance at all. Fine. Now keeping this forward, let's go forward regarding the cause of death, right? But for you to learn the cause of death, do remember, first of all, you need to know, see, the cause of death depends on the organ which is damaged. The organ which is damaged, it depends on the route of current in the body. Fine. So do remember, so basically, indirectly it means the cause of death depends on the route of current in the body. That's what it means, right? I repeat, the cause of death depends on route of current. Fine. Right. Now there are two things that you need to know. Right? Fine. Number one, whenever, see, the person can get electrocuted only when the circuit is complete. Only when the circuit is complete, the person will get electrocuted. I'll tell you what it is. Right? And always, the electricity will take the shortest route. Fine. So just do remember, just do keep these 2 points in mind. Only when the circuit is complete, the person will get electrocuted, and always electricity will take the shortest route. Fine. Just do keep these two things in mind. Now let us say this is the person standing here, right? And you can see there is electrocution, is touching. Fine. Now will he get electrocuted? He will not get electrocuted. Though the electricity is touching the electricity, electrons may enter into the body, it cannot come out, because see here, he is not touching anything. Is not touching anything. There is no contact with the ground and he is not touching anything. The air current can enter into the body, but it cannot come out. Only when it comes out, only when the circuit is complete, he becomes a part of the circuit and he will get electrocuted. I am repeating again, do listen very carefully. Only when the electricity comes out of the body, right, the circuit becomes complete, right, the person becomes a part of the circuit, right, and he can get electrocuted. Right now the circuit is incomplete, he will not get electrocuted. Now see here, if he is touching something, you can see he is touching this metal rod. When he is touching this metal post, what happens? The electricity can enter into the body, it can come out of the body. Or if the feet is touching the ground, the current can either pass out in this place, or it can pass out in this place, or it can pass out in this place, depending on whichever is shortest. Okay, so coming back to the same point, do remember two things: it should be complete circuit and it has to be shortest route. Now you can see, now the person's entry is in right hand, the current passes through, right, and entry is in right hand, exit is in left hand. Now the person, right, suffers from cardiac arrhythmia, right, the person suffers from cardiac arrhythmia, person dies. Fine. Let us look at some other route. Right now the current is passing from the head, entry is in the head, right, exit may be coming out in the foot. What is the cause of death? Right, don't think the current passes through the heart, but before the current reaches the heart, it has to pass through brain, right? So the point is, the person will suffer from, right, brainstem paralysis, the brainstem lesion. The person can die of respiratory failure. Person can suffer from respiratory failure, person will die, right, if the entry is in the head. Right, let's see the another way. So this is entry is in the right hand, and you can also see exit is in the right foot itself. Here the current doesn't pass through the heart, but still the current can pass through respiratory muscles, intercostal muscles, the diaphragm. The person can suffer from respiratory failure again, right? So that is another way, another cause of death. You see here again, the entry is in right hand, exit is in the left foot. Okay, now again, person suffers from cardiac arrhythmia and the person dies. Right? They say that this is the most dangerous circuit because large amount of current is passing through the heart only in this particular circuit because of the axis of the heart. Okay, fine. So I've given you all these types of route, but still you can see in all these route, in all these possibilities, there are only two causes of death. Number one, it is cardiac arrhythmia. The person suffers from ventricular fibrillation. That is the most commonest cause. That is the most commonest cause of death in electrocution, because you could have seen that heart is getting affected in more than one pathway. Not even one pathway. One pathway. It is getting affected in more than one pathway. That is why this ventricular fibrillation is the most commonest cause. Apart from that, I also told you that it can be due to respiratory failure, maybe due to brainstem involvement, or due to respiratory muscle impairment. Okay. So these are the different causes of death we get. And if they ask you which is the most commonest cause, you can easily say that it is cardiac arrhythmia. Fine. Now we have discussed about the cause of death. Now we'll be discussing on the injuries produced by the electricity. So let's talk about the burns which it creates. You can say it is the post-mortem finding. Let's talk about that. Let's talk about the lesions produced by the electrocution. Fine. Let's talk about that. Now let's say skin. Fine. Skin. If it is low voltage, if it is low voltage current, right, if it is low voltage currents, obviously there should be a firm contact of the skin with the conductor, right, skin with the conductor. Let us say this is the skin, right, this is the skin. Fine. Now let us assume that this is your electrical wire. This is your electrical wire which is made up of metallic conductor. Let us assume it is copper. Assuming that it is copper. It may be copper, it may be aluminum, whatever it is. So let us assume that it is copper. What happens is, see, whenever there is a electricity passing from the electrical wire into the skin, whenever the electricity passing from the electrical wire into the skin, at this point of area there is generation of heat. Because of the generation of heat, we get blister formation. That blister formation will get collapsed. It forms like a crater, right? So that is basically a collapsed blister, right? That's collapsed blister. You will find a crater like burns, right? There is a central crater, which is surrounded by a peripheral margin, right? Fine. So this is how the burn will appear, and this burn is called as Joule burn, right? This burn is called as Joule burn. When you see from above, when you see from out, right, on the skin, how will it appear? You can see that this is a central depressed area, right? This is a central depressed area which is surrounded by a peripheral raised border. In addition to that, just around the raised border, you can see a pale areola. That is more important. Central depressed floor, peripheral areola. This is floor, right? And this is pale areola. That is again very, very important. Right? What is even more important is, sometimes what happens, there can be a mild hyperemia noted just around this areola. Right? They say that is also equally important to say whether it is antemortem or not. Okay, so the mild hyperemic layer will be there. Fine. So this is the appearance of the Joule burn. This is the appearance of Joule burn. Now I told you, right, this burn is due to the production of heat, right, when there is passage of electricity from the wire into the skin. I repeat, this burn is due to the generation of heat when the electricity is passing from the wire into the skin, right? The heat is generated in the skin itself. When the heat is generated in the skin itself and you get a burn, this Joule burn is also called as endogenous burn, right? This is also called as endogenous burn. Endogenous, produced in the skin itself, produced in the body itself. That's why it is called as endogenous burn. Okay, clear? So that is highly important. Now see, I told you again, you see the electrical wire is made up of metallic conductor. Sometimes what happens, when there is passage of electricity from the wire into the skin, when there is a passage of electricity from the wire into the skin, it is not only the electricity that is passing, but do remember, some amount of metallic ions from the conductor will also be getting deposited in the entry wound, right? You can also find the metallic ions getting deposited in the entry wound. That is called metallization, right? That is called metallization, that you can see in the entry wound, right? The metallic ions will differ depending on whichever conductor was there, right? From whichever conductor the person got electrocuted, the metallic ion will differ. Fine, so that is again very important. And you see, this metallization can be identified by a test that is called acro reaction test, right? That is called acro reaction test, that will be used to identify this metallization. Sometimes what they say, the recent studies say that the color of the entry wound will also differing depending on whichever metallic ion was getting deposited. That means basically whichever metallic conductor was there. For example, if it is aluminium conductor, you can see silvery color, right? If it is copper, you will find a reddish brown, right? If it is iron, you can see brownish black, right? So depending on, right, so this is the important stuff that you need to know, extra H. Right, so depending on whichever conductor was there, the color of the burn's color will differ. Okay, so do remember, this is Joule burn. I told you this is endogenous burn. I told you the appearance of the Joule burn itself, and it is low voltage burn. And you also remember this is low voltage burn which needs firm contact. which needs firm contact. Fine. Now going forward, so I told you that it is low voltage. What if it is high voltage? Let's talk about high voltage. If it is high voltage burns, there need not be any kind of firm contact. Even loose contact is sufficient, right? Even if there is loose contact, this is fine, right? Because high voltage current will pass air gap as well. It jumps the air gap as well, right? We get two important types of burns. One is flash burns, right? And do remember, if there is a spark, you will get spark burn as well, right? We'll get spark burn as well, right? I'll show you the spark burn. First of all, I'll show you joule burn. Have a look at it. So this is the low voltage burn with firm contact, wherein you can see the joule burn. I told you it will be basically a collapsed blister, right? You can see it is covered by the pale areola. If it's a tight contact, firm contact, right? You can see this is the joule burn. You can see the areola, pale areola, everything. Now, see if it is a spark burn. If it is a spark, what happens is from the conductor, the spark jumps and enters the skin. It is melting the skin. It is melting the keratin. There will be keratin melting, right? There will be keratin melting on the skin, right? Because of the spark. Because of the spark, there can be keratin melting on the skin. On cooling, what happens? You will find a brownish nodule, right? You will find a brownish nodule with a pale areola. Again, you will have a pale areola, right? You can see this is the brownish nodule with the pale areola, and this keratin, this brownish nodule is basically nothing but the keratin nodule. This is basically nothing but keratin nodule. So basically the spark burn produces keratin nodule. It produces keratin nodule. Fine. So that is highly important. It's elevated from the adjacent skin. Keratin nodule. What if there is very high voltage, multiple sparks affecting the skin? If there is multiple spark acting on the skin, what happens? You will have multiple nodules on the skin. Multiple nodules on the skin, right? The skin will be appearing like a crocodile. That is why this burn is called as crocodile burn, right? Because of extensive high voltage, if there are a lot of because of lot of sparks, right, affecting the skin, burning the skin, you will have multiple nodules on the skin. Because of the multiple nodules, the skin will be looking like a skin of a crocodile, and that is the reason why this burn is called as crocodile burn, right? And do remember, this flash burn, the spark burn, crocodile burn, everything is exogenous burn. That is not endogenous burn. This is basically exogenous burn, right? All these are exogenous burn. Fine. So if they ask you what is endogenous, your job become very simple. In electrocution, joule burn is the endogenous burn. It's very simple. Fine. Okay. Now moving further, let's talk about the other manifestations because of this electrocution. I told you the metallic ions will get deposited on the skin. It is not only getting deposited in the skin, some amount of molten metal, right? Some amount of molten metal will also be deposited in the deeper tissue, right? You will have the presence of molten metal in the deeper tissue. Fine. So that is called as current pearl. We call this as current pearl. Current pearl. Fine. So this is very important. So when the current passes through the bone, when the high voltage current passes through the bone, let us say this is the bone, what happens is the high voltage, it is melting the calcium phosphate. When it is melting the calcium phosphate, you will find round densities, right, in the X-ray, that you can see in the X-ray, which is called as bone pearl, right? What we have seen earlier was current pearl. Now this is bone pearl, which is also called as wax drippings, right? You ask me what is this? It is nothing but this is nothing but your molten calcium phosphate, right? Molten calcium phosphate. Now, does it leave the muscle? No, never. Right? It is causing a degeneration of the skeletal muscle, which we call it as Zenker's degeneration. Right? It is called as Zenker's degeneration. Because of this, there can be rhabdomyolysis. There can be rhabdomyolysis, and you know very well, when there is rhabdomyolysis, you will get myoglobinuria, and that will cause renal failure. Right? That will even cause renal failure. So do remember, I have just given you in sequence. It is in the deeper tissues. Then I told you about the bone. Then I've told you about the muscle. Right? I've told you about each and every layer. Right? I would like to show you this one. This is your crocodile burn. Right? And this is flash burn. Now, what about the medico-legal importance? What is the medico-legal importance of this electrocution? Right? What is the medico-legal importance of electrocution? Do remember, usually it is accidental. Most of the times it is accidental. Right? Sometimes it may be homicidal. Right? One of the most important thing that we need to know regarding homicidal is judicial electrocution. Right? Judicial electrocution is used as a form of execution, judicial execution in US. Right? Here we have hanging, but judicial execution can also be done by electrocution thing. Fine? And sometimes it can also be suicidal. Fine? Okay? So which is most common? Most commonly it is accidental. Okay? Right. So once we have discussed electrical injuries, now we'll be moving on to one more important injuries, that is lightning. Right? We can say this is basically a variant of electrocution only. But here the current is passing from the clouds. Fine? What is basically lightning? This is basically electrical discharge. This is basically electrical discharge from the clouds to the ground. From the clouds to the ground, to the earth's surface. But the amount of current that is coming, it's very, very high. You can say it is high voltage. But what kind of current it is? It is AC or DC. Do remember, it is DC. But it comes in unimaginable, right, voltage. You can see it is 1000 million volts. It is 1000 million volts. When you express in terms of ampere, it is 2 lakhs amperes. Right? So much. Okay? Fine. Now, the study of lightning. The study of lightning is called as keranomedicine. Fine. This is also called as keranopathology. Pathological aspects is called keranopathology. Right? Medical aspects is called keranomedicine. Right? Pathological aspect, that is keranopathology. But what we have to know is kerano means lightning. Okay? If you know that, it should be fine. Okay? Kerano means lightning. Anything that comes with the word kerano, it has to be associated with lightning. Keranoparalysis. Right? There was one exam where they asked this, what is keranoparalysis? That is associated with lightning. Okay? See, you can see this is basically the lightning strike. Fine. You can see I told you that it is electrical discharge from the clouds to the ground. Right? When the person comes between, the person will get right effects. You can see what are the ways by which the person comes into contact with lightning strike. Number one, the lightning can directly strike just like this. Right? This fellow is touching this lightning storm. Right? So this is basically a direct strike. You can see, or side strike, it is hitting some surface and getting reflected to this victim. Or if he is touching any kind of object, metallic object, sometimes if it can pass through the metal tube, metallic pipe or something, where he will touch and the person can get suffer from this lightning strike. Okay, so these are the different ways by which he can get contact. But because of this, what are the effects? The lightning effect are basically, right, the injuries in lightning are basically due to direct contact. When it is directly hitting, the person can get injury, or it is due to superheated hair that comes along with lightning strike, or the expanded and rippled hair, or what is called a sledgehammer effect. Right? Sledgehammer effect. Sledgehammer effect is basically the blow to the compressed air that is pushed before the current. right? It is blow of the compressed air that is pushed before the current, that is called sledgehammer effect. All these things can cause damage, injuries to the victim, right? Now let's talk about what are the different lesions that you get in case of, what are the different burns that we get in case of lightning. Let's talk about that, right? As soon as I ask you what are the different burns that you get with lightning, right, most of you would think it is filigree burns, but do remember it is not only filigree burns, right? It is not only filigree burns. You get every type of burns in lightning. You get every type of burns in lightning, not only filigree burns. Let's say, what are they? Number one, you get linear burns. You get linear burns, right? Particularly in the skin creases, right? In the skin creases, you get this, right? Linear burns, right? You will also get pitted burns. All these are endogenous burns. Do make a note of it, guys. All these are endogenous burns. Exogenous burns also there, but whatever I told you so far, all these are endogenous. Even filigree burn, the third one, that is lightning burns or filigree burns, that is also endogenous. You can see lightning burns, right? It is also called as filigree burns. Filigree burns. It is also called as arborescent burns. Arborescent markings or arborescent burns, right? Arborescent burns. It is also called as ferning, right? It is also called as Lichtenberg burns. It is also called as keranographic burns, right? So you basically have a lot of synonyms for this, and all these synonyms were exploited by the examiners in multiple exams, right? Many times, like in every exam. See, basically filigree burns is something where you frequently get in the exam, but every time they will keep asking one synonym, right? So that they think that they are making the questions very tough, right? So what we have to basically know is we need to know all the synonyms of this filigree burns, right? And you want to know one more thing, I'll tell you another thing that is also called as feathering, right? So all these are basically filigree burns. All these are basically filigree burns. What is the appearance of filigree burns? So this is basically the appearance of filigree burns. You can see, what you can see is a branch. This is not filigree burn, right? This is basically branching part. Right? Why I showed you this? Because the filigree burns will also be having same kind of branching pattern. You can see it has got branching pattern. You don't get that in all the cases. You get only in 20 to 30% of cases you get this filigree burns. That is really important. You don't think that in all the case of lightning we get filigree burns. It's not like that, right? And if it is appeared, it will be there up to 48 hours, right? It will be there up to 48 hours. And I hope that you all know marbling that we have discussed earlier. Marbling also has got similar pattern, but do remember, marbling is something where you can see that is going along the blood vessel, but here it is not along the blood vessel. For that, what you have to know is, first of all, you need to know what is the mechanism of this. What is the mechanism of this, right? This mechanism of this is, it is basically the passage of electrical discharge, right? Passage of electrical discharge in the body. Right, wherever there is passage of electrical discharge in the body, you will get RBC lysis, hemolysis, right? And that is seen on the skin. It is not inside the vessel. It is on the skin that you see. It is on the skin that you see. So basically, it is not along the blood vessel. That's what you need to know, right? If it is along the blood vessel, then it has to be marbling. This one, filigree burn, is not along the blood vessel. It is not along the blood vessel. And you can see what is the cause of death here. The cause of death here is cardiac arrhythmia. The person can die of cardiac arrhythmia. Fine, cardiac arrhythmia. Right? And one more thing is, what is the medico-legal importance? Is it accidental, homicidal, suicidal? See, almost always it is accidental. Right? Cannot be homicidal, cannot be suicidal. So this is the filigree burns which we were talking about. You can see the fern-like pattern, the branching pattern that you can see typically in this area. Okay, so as I told you that it is due to It is due to RBC lysis. Fine. Now we'll be moving on to one more important area, that is explosion injuries, right? Explosion injury, bomb blast injuries. We'll discuss about that. What is basically a bomb? Bomb is a container that is filled with explosive material. It's a container that is filled with explosive material, sometimes missiles, right? Projectiles, shrapnels, missiles, projectiles, shrapnels, right? Everything is same. So this container filled with explosive material is fired by a detonator or fuse. Is ignited by a detonator or fuse. That is basically bomb. Fine. Right, you have various types of bomb, right? What is incendiary bomb? Incendiary bomb is something that contains phosphorus, right? It is something that contains phosphorus, right? When you throw on somebody, right, it will catch fire. Phosphorus will catch fire. That's called incendiary bomb. We have one more important thing that is called Molotov's cocktail. What is Molotov's cocktail? Molotov's cocktail is nothing but petrol bomb. It is nothing but petrol bomb. You can see this bottle is filled with petrol. This bottle is filled with petrol and you will have a rag basically on the top to serve as a wick. What we have to do is you need to light the wick, right, and throw it on a surface, right, wherever you want to throw, right, and on that surface, when you on throwing, this will get broken and it will catch fire. The entire thing will catch fire. So this is called petrol bomb. It is otherwise called as Molotov's cocktail. Fine. So let's talk about what are the different type of blast injuries we have got. We'll discuss about that. Right. Basically, we have got three types of blast injuries. Three types of blast injuries. Types of blast. What are the three types of blast we have got? Number one, it is air blast. Number two, it is immersion blast. Right. Immersion blast. Basically, it is under the liquid medium, or you can say it is underwater blast. Right, that is called immersion blast, underwater blast, underwater blast. There is one more blast that is called solid blast. Solid blast. What is a solid blast? Solid blast is something where what happens here, right? Solid blast is something where what happens, a part of body, when a part of the body is in contact with any solid vibrating surface. If there is any solid vibrating surface, right, and a part of the body is in contact with the solid vibrating surface. On the other side, if there is a bomb blast, that wave will pass through this solid vibrating surface and we will get injury, right? So when a part of the body is in contact with a solid vibrating surface, right? Or you can even find that in a person who is standing on the deck of a ship and the blast occurring under the water. The wave passes through the ship, the person is on the deck of the ship and he may get injury. That is also an example of solid blast, right? You have a lot of examples for that. Air blast, immersion blast, solid blast. So we will see what happens first in a air blast. That is more important. First of all, when you want to know what are the injuries that is caused by air blast, you need to know what are the products produced by the air blast. So we'll discuss about that, right? You can see if there is a bomb blast, assume there is a bomb and that is getting blasted. So whenever there is a bomb blast, what is the first product? The first product, right? First, let us say this is a bomb and there is a bomb blast. The first product is a blast wave. High pressure blast wave starts from the site of explosion. It spreads concentrically outwards. Right? This blast wave passes through the body of the people who are standing over there. Fine. And do remember, this blast wave, high pressure wave, does not affect the solid organs like liver, spleen and all. It usually affects the organs which is having air inside it. Right? For example, here lung, GIT will be affected. Okay, so the first and foremost important product is blast wave. And do remember, this blast wave is directional. It spreads in all direction. There's no specific direction for that. It's not directional. It is non-directional. It is non-directional. Fine. So this is blast wave. The second product, right? When the bomb is getting blasted, even small broken pieces will fly at a high speed. Right? Or sometimes what happens, the terrorists might implant screws, nail, lead shots into the bomb, because when the bomb explodes, these small things will fly at a high speed, injure the victim. right? We call it as flying missiles, we call it as flying projectiles, we call it as shrapnels. You have lot of terms to call this. But what happens here is, this comes at a high force, it will injure the victim. So the point is, it is directional. For example, if I am sitting here, if there is a bomb which is getting blasted in front of me, because of the missiles, because of the flying missiles, my anterior surface of the body will be injured, right? If there is a bomb which is blown behind my back, my posterior surface of the body will be injured based on the flying missiles. It is not on the anterior surface. So basically, it will tell you the directional, right? So this is again very important. Do remember, this is flying missiles. Now, when the bomb is getting exploded, because of the wind, right? Because of the wind, the victim will get thrown away, victim displacement. He may fall on the tree, or he may fall on any solid structure, he may fall on the wall, he can get skeletal injuries, right? This is the third important product. What is the fourth product? There is also one fourth product, that is miscellaneous. Suppose if there is a bomb blast in the building, right? The bomb is getting exploded in the second floor, right? And the person is standing on the third floor. Because of the bomb explosion in the second floor, the building is collapsing. The person victim in the third floor will also be injured. That is building collapse. Or because of the same blast, what happens? There can be a fire in the second floor, and the victim in the second floor will be suffering from burns injury due to fire. So all these are miscellaneous. Right? So for you to understand, you can see I have just tabulated it. You can see that first one is blast wave, second one is flying missiles, third one is wind, and the last one is miscellaneous. Right? Okay, let us see what are the products produced and what are the injuries produced. Right? See, the injuries produced by blast wave, that is called primary blast injuries. Injuries produced by blast wave, that is called primary blast injuries. Primary blast. I told you this is due to blast wave. What are the organs getting affected? I told you ear, right? I told you lung. I also told you GIT. 3 important organs getting affected, right? In the ear, you remember the most common injury that you can think of is tympanic membrane rupture. That is the most commonly you will find. Fine. And in the lung, this blast wave passes through the lung of the victim. It is ripping off all the alveolar membrane. It is ripping off all the epithelium from the basement membrane. So what happens is, the person will be having ARDS, diffuse lung injury. And this is so severe, it can be fatal. We call this as blast lung. Right? We call this as blast lung, which is highly fatal. GIT, again, the person can have similar effect. The person can have injury to the intestine. The person can have perforation of the intestine. So all these things do happen. Right? So very important. Now, coming to the second product, flying missiles. I told you flying missiles, shrapnels and projectiles. It is thrown away. Whatever injury that is produced by the flying missiles, we call it a secondary blast injury. Right? Secondary blast injury. I told you what happens if I am the victim staying here. If there is a bomb in front of me that is getting blasted, the flying missiles will come and injure my anterior surface of the body, the front of the body. But in this surface of the body, what happens? The person will have abrasion, the person will have contusion, the person will have laceration, right, on the same side of the body. Right, the person can have punctate abrasion, contusion, laceration, punctate abrasion, contusion, laceration in the same side of the body, right, which we call this as Marshall's triad. Right, we call this as Marshall's triad. Do remember, this is a triad of this abrasion, contusion, laceration, same side of the body. The reason why we need to know is, you need to know whether the person was facing the bomb or the bomb was exploding behind the back. Okay, so you would like to know that. For that, this particular direction becomes highly important. Fine. And coming to the third product, that is wind. Injuries produced by wind, we call it as tertiary blast injury. Tertiary blast injury, where I told you a person be thrown away. When the victim is thrown away, the person can get skeletal fracture. Right. And the last one, I told you miscellaneous. I told you there can be a building collapse, there can be a fire in the building. All these injuries will be called as quaternary blast injury. Okay, it's very simple. Primary, secondary, tertiary, quaternary. You just have to know the sequence. First one is blast wave, second one is flying projectile, third one is wind, and the last one is miscellaneous. What injury that you can get in quaternary? The person can get burns due to fire, or there can be a building collapse. Depending on whatever is there, the person can have injuries, right? Building collapse can cause traumatic asphyxia, right? Building collapse can cause traumatic asphyxia, right? So all these are the different injuries that you get. But see, I've told you all these injuries. Out of all the injuries, which is the most common blast injury? Remember, the most common blast injury is secondary blast injury. Most common blast injury. Which is the most common primary blast injury? The most common primary blast injury is tympanic membrane rupture, right? Tympanic membrane rupture. Which is the most common, right, primary blast injury? That is tympanic membrane rupture. Which is the most fatal? Which is the most fatal primary blast injury? That is nothing but blast lung. I told you that is highly serious and it is fatal. Okay, so there is a difference between most common blast injury, most common primary blast, and most fatal primary blast. Fine, right? So this is primary, secondary, tertiary, and quaternary. Now, what is called underwater blast? Right? In underwater blast, we normally get only one question: whether GIT is affected or ear is affected due to blast wave. Right? In that case, the next question that you should ask is whether the head is above the water level or below the water level, right? If the head is below the water level, what happens is the blast wave passes through the water into the ear. The person can have tympanic membrane injury, right? Ear injury, oral injury will be there. In case, if the head is above the water level, what happens? If the head is above the water level, what happens? Right? The GIT will be commonly injured. Right? GIT injury is common. Okay? Ear injury is common if the head is below the water. If the head is above the water level, GIT injury is very common. So this is very logical, right? It doesn't make more complexity. It's not that complex. It's very, very logical. Just need to think, right, how the water, when the head is below the water level, the shock wave passes through the ear and it causes ear injury, right? On the converse, if the head is above, obviously ear will not be injured, GIT will be injured. Okay, so this is what you need to know with regard to the blast injuries. Let's discuss something in torture methods. Okay, we'll discuss something in torture methods. We get questions on this torture methods as well. I hope you remember we discussed something about Declaration of Tokyo, right? Declaration of Tokyo is something which is related to torture, dealing with tortured victims. How do you treat? How do you report the incident to the authorities? So all these guidelines for the doctors given by the Declaration of Tokyo. Just keep reminding about that. Now we'll be discussing about the different methods that we have got in torture methods. I'll tell you all the torture methods. Then I'll be showing you the torture methods as well. The images. Okay, images. Fine. So let's see. Number one. Right. Repeated slapping over the ears. Repeated slapping over the ears. That is called telephono. That is called telephono. You can easily remember. Phone, we keep it on the ear, no? We keep it over the phone. So that is telephono, right? Beating over the soles. Beating over the soles, right? That is called falanca. It is called falanca. Sometimes they mention falaka, or it is also called as bastinado. Bastinado, right? Falanca, falaka, bastinado, everything is same, right? Immersing the head of the victim underwater. Forced immersion. Forced immersion of head underwater. Forced immersion of head underwater. So that is called as torturing the person by immersing the head underwater forcefully, right? That is called wet submarine. Wet submarine. Sometimes what happens, not only the head, the entire body, the entire person, victim will be immersed underwater forcefully. Forced immersion of the victim underwater. Forced immersion of the body, the whole body underwater. So this type of torture, it is called as dunking, right? So this is called dunking. Okay. Sometimes they'll tie a plastic bag around the head of the victim and the person will not be able to breathe. He'll get asphyxiated. So that kind of plastic bag asphyxiation, right? Plastic bag asphyxiation, we call this as dry submarine, right? We call this as dry submarine. Fine. Okay. Tying the limbs along horizontal pole, maybe a rod or something. The hands and the limbs will be tied in the rod and the person will be suspended. Horizontal pole, right? Which is called as parrot's perch. Okay, so that's called parrot's perch. Giving electric shock, generally to genitalia, so that is called cattle's prod, right? We call it as cattle prod. Okay. Then inserting hot metal rod, right? Maybe an iron rod, maybe a screwdriver, whatever it is. If it is so hot, into the anus of the victim, then it is called as black slave, right? During black slavery period, it was very common. It's called black slave, right? Force straddling, person has to be forcefully sitting on a sharp platform. We call it as force straddling. This is called sawhorse, right? Remember, a person sitting on the horse, right? This person sitting on a sawhorse. Okay, right? There is one more important thing is there, which was asked recently in INICT examination. The person will be in a prone position. The hands, the wrist and the ankle will be tied behind. And the person will be prone. The victim will be in the prone position. Tying the wrist and ankle together in a prone position. In prone position, we call this as hawk tying, right? We call this as hawk tying, right? Sometimes the person will be made to stand for a long time, prolonged standing. Person will not be able to stand. Person will be made to stand for a long time, prolonged standing. That is called L planton. Prolonged standing. We call this as L planton, right? So these are the different various torture. This is some of the torture methods which are relevant for the examination, but we have lot of torture methods available. But these are the important torture methods which are important for the examination purpose, right? You can see this is dry submarine. I told you plastic bag asphyxia. You can see that. And you can see this is wet submarine where the head of the person is forcefully immersed into the water, mostly sewage water. So this is dunking. The whole person is, right, immersed under water. This kind of torture is called as dunking. This is sawhorse. I told sitting on a sharp platform. This is called sawhorse. And this is beating over the ears. That is telephono. Beating over the soles. That is called bastinado. And this is hawk tying. Hawk tying, I told you, tying the wrist and ankle in a prone position. That is called hawk tying. Okay. This is prolonged standing, planton. So this is cattle prod, by which they give electric shock to genitalia. So this is cattle prod. Okay.